Welcome to the Joint Care Center at St. Joseph East, recently recognized as a top 100 hospital by Thomson Reuters. What should you expect from the Joint Care Center at St. Joseph East for your total joint replacement surgery? World-class physicians, an atmosphere of wellness which will contribute to your healing and reduce the amount of time you will need to spend in the hospital. A team of dedicated, highly trained professionals who care about your experience with St. Joseph East and your quality of life. The aim of joint replacement surgery is to relieve your pain and to restore your independence. Candidates for joint replacement surgery experience chronic pain, which interferes with daily activities. Your symptoms may be unique, but one thing that joint replacement candidates have in common is that when it's time, you and your doctor know.
I had a left knee replacement. I wouldn't go anywhere else but St. Joseph East. I've been treated good. Dr. D'Angelo does his surgery here, and so I wanted to come to be where the best was.
This is a wonderful operation. It looks like a very involved procedure, but it's very routine, and we do hundreds of them a year. And it's a very satisfactory procedure. The National Institute of Health has found that this is the second most effective procedure that an American can have in terms of improving their lifestyle. It isn't without risks. There are risks of bleeding and infection and dislocations and that type of thing, but those are very rare and they're usually less than 1%. And so 95% of patients who have this procedure will get good or excellent results, and they'll really enjoy it.
Recovery times are much quicker than they used to be. We're having patients mobile sooner, getting them out of the hospital sooner than we used to because of the pain limited motion and limited ability to function. So they had to stay in the hospital longer before. So pain control there is a very big deal in these joint procedures.
And the goal is to get them up independent, dressed, ready, walking, and to be as independent as they can be before they're discharged to home.
Well, they've all been wonderful.
So she's had a good experience.
But if they ever have any questions, they can just tell their nurse, and I will be there in a heartbeat to come talk to them about whatever questions they may have.
My main focus is patients. Means they come first.
You want anything, just ask, and they're here.
We've seen a shorter length of stay. If they have surgery on a Monday, most of the time they go home Wednesday morning. So that's pretty quick. I mean, we've seen some patients go home the next day.
I think I've also seen that patients are more educated. Maybe they're using the internet and things like that to get more prepared. They're also coming to our preoperative education classes, but I think they kind of know more of what to expect. So,
in the time that I've been here, I definitely think that replacements in general, whether that be a knee, a hip, or any other orthopedic surgery, these people are in and out. Typically, post-op day one, they're already starting to get up out of bed, ambulating, and so I think that that's a vast improvement, because who would have thought that your first day post-operatively that you would be able to walk and get up out of bed.
You're going to have pain, but most of our patients say, oh, the pain I've been having for 6 months or a year is nothing compared. This surgery pain is not what I've been going through.
It's just to make sure that they're going to be independent, you know, when they go home, that they can do everything that they were doing before surgery.
We want them to be able to do everything they need or want to do at home.
We want them to be moving even better than they were before surgery, because that's why they had the surgery.
So I do think that the outcome is wonderful and, I don't know, better than what would have been years ago, I think.
It makes a huge difference in their lifestyle, where before you couldn't, say, get out of a chair or go up and down stairs or even sleep through the night. You find very quickly after this operation that you're able to do that, and it's just a wonderful lease on life, and most people enjoy it very much, and it's well worth doing.
Well, the only thing I'd say is come to St. Joe East, and I think you'll be very comfortable and very pleased with what you're getting.
Your doctor, your Joint Care Center team, and your total joint replacement surgery will be unique to you. But with your participation, we look forward to a positive outcome and your brighter future.